Miss Shandick.
Hi, how are you?
Hi, good. How are you? Chandler Zalek, student nurse practitioner.
Very nice to see you again.
Yeah, you too. Yep, I did your skin assessment last week.
Awesome.
So what brings you in today?
I'm in for just a normal wellness checkup.
Okay, sure. And I saw on your chart of the head, the eyes, the ears, the nose.
Yep.
Okay, all right, perfect. Now, do you have any of issues in those parts? Do you have any contacts in right now?
I do have contacts.
You have contacts in, okay. Do you mostly wear glasses versus contacts?
No, contacts over glasses.
Okay. Any issues with your hearing?
No.
No, okay. When's the last time you've been to the eye doctor just for a regular eye exam?
I was just there back in March.
Back in March? Okay, perfect. Any problems with your lymph nodes at all? Have you ever been told you've had enlarged lymph nodes?
Only when I'm sick.
Okay, any thyroid issues?
Nope.
Okay, how about mouth issues? Do you see a dentist normally?
Yes, every 6.
Okay, perfect. And any nose issues?
Nope.
Any drainage, any abnormal congestion?
Just
like
normal allergies.
Okay.
Otherwise, no.
All right, sounds good. So we'll get started.
Okay.
I'm going to put my gloves on, and I'm going to start with the head, okay?
Okay.
So I'm just going to examine the scalp first. I'm going to inspect it and palpate it for symmetry and for hair growth patterns. So I'm just going to start here. Okay. Any pain when I do this at all?
No.
Okay. Looks symmetrical, even distribution of the hair patterns. Okay, no pain back there at all?
No.
Okay, all right, good. So now I'm going to go and we're going to start with your eyes.
Okay.
Okay, so what I want you to do is I want you to look at my nose and I'm going to pull your lid down. The bottom of your lid, I'm just going to look at the conjunctiva. Okay, just look right at my nose. Perfect. They're pink, they're moist, no redness. Excellent. Any pain with that at all?
No.
Okay, so now I'm going to use my pen light. And I'm going to check for pupillary reflexes, both direct and consensual. So, just keep looking at my nose, okay? Good. Any sensitivity to that light at all?
No.
No. All right. So next what I'm going to do is I want you to keep your head still, and I want you to follow my fingers, okay? So just with your eyes. Any pain looking up or down, anything like that?
Nope.
All right. Excellent. Now I'm just going to dim the light and take out my optometroscope. And this is for pupillary constriction. I'm now going to lift the top of your eye. I'm going to be looking at the optic disc.
Okay.
Okay. Get my light. All right. So I'm going to start from afar. And I'm going to move closer. It looks good. I'm looking at all 4 quadrants, even, symmetrical. Now I'm going to do the same for the next eye. Perfect. All right. The eyes look good. Do you have any problems with eye itchiness or dryness at all?
Itchiness from allergies.
Okay. All right. Perfect. So now we're going to go to your lymph nodes. I'm going to start by just palpating for abnormalities, for enlargement. At any point, if it hurts, you just tell me, okay? Okay. I'm going to start here. Good. Perfect. Now I'm going to move down to the supraclavicular. Can you just tilt your head down? Perfect. Any pain with that at all?
No.
All right. Next part of my exam, I'm going to examine your trachea. Your trachea is midline. It's symmetrical. No abnormalities with it at all. Any pain to the touch?
No.
Okay. And can you just turn your head at a 90-degree angle? Perfect. That's midline as well, symmetrical. All right. Next, I'm going to be examining your thyroid cartilage. Have you ever had your thyroid examined? I'm going to give you some water and have you take a sip and hold it.
I have had it tested.
All right. Perfect. All right. So first, I'm just going to feel for it. It might feel a little funny. I'm going to move your trachea a little bit. Okay, good. So now can you take a sip of water for me?
Sure.
And you can swallow that. Perfect. Okay, so now the next test, I just want you to hold it in your mouth. So another sip of water. And hold it. Great. All right, you can swallow that. Perfect. So now next in the assessment is for the carotid arteries.
Okay.
So I'm going to palpate them first. First the right. Good. Any pain, tenderness?
No.
Nope. The neck is supple. It's symmetrical. Good. So now I'm going to listen for a carotid bruit. So I'm going to take my stethoscope. I want you to take a breath and then stop, okay?
Okay.
Go ahead. Good. And now I'm going to test the other. You can let out and take a breath and hold it. Perfect. Now you can relax and breathe normally. Great. All right, so now the next part of the assessment is for the ears.
Okay.
So I'll do each individual. If you just want to turn your head, look straight. Perfect. So the first thing I'm going to do is I'm going to just inspect it. It looks good. It looks symmetrical. There's no redness, no abnormalities, excuse me. No implants, correct?
No.
Okay, I don't see any scarring or anything like that. So I'm going to pull back the pinna. I'm going to take a look. I'm looking into the ear canal. No wax buildup. Any pain with this at all?
No.
No. Okay. I'm looking at the tympanic membrane. Everything is pink, dry, no lesions. So now I'm going to have you cover your ear, and we're going to do the whisper test.
Okay.
Yep, so if you want to cover, yep, that ear, perfect. Can you hear what I'm saying?
Yes.
21.
21.
Perfect. And now the other one. Come to the other side.
27.
Excellent, excellent. No changes in your hearing that you've noticed at all recently?
Nope.
Okay, good. So now we're going to move on to the nose. I'm going to look at you head on, anterior view. It looks straight. It's midline, no deviation. Can you turn your head facing forward? Perfect. It's symmetrical, no bumps, no abnormalities. The dorsum is center. It's midline. I'm just looking for deformities, and now you can look back at me. Perfect. Now, are you a nose or a mouth breather?
I believe nose.
A nose breather. Okay, perfect. So what I'm going to do now is I'm going to cover your nostril. I'm going to have you breathe in from the other side, okay? Good. Any problems with that? No pain?
No.
Okay, good. So now I'm just going to have you tilt your head up, and I'm going to look with my light. And at this point, I'm just looking for any deviation. Looking at the septum. I'm looking at the mucus path and polyps. Looks good. Even distribution of hair in there. Perfect. I don't see any lesions, no redness. All right, so then the next is the mouth. So I'm just looking for symmetry of the lips and the mouth. Everything looks good. Any pain at all? No. Any pain under here? No dental visits, no dental cavities or procedures recently?
No, not recently.
Okay, excellent. So now I'm going to have you open wide and tongue left and tongue right. Perfect. Tongue up and tongue down. Great. So now I'm going to take my light. I'm just going to be looking at the buccal mucosa, the soft and hard palate. All right. Go ahead. Tongue up. Good. And down. Perfect. It's pink. It's moist. No lesions again. And then lastly, I'm just going to examine your voice.
Okay.
Okay. Any vocal cord dysfunction that you've ever had in the past?
No.
Okay, perfect. Can you take a deep breath for me? Yep, and go ahead, breathe out. With that, I was just listening for inspiratory or expiratory, audible, stridor, or wheezing. I didn't hear any of that. And can you cough for me? Okay. And any problems with that at all? No, you don't feel like you're bringing anything up?
No.
Okay. Well, Miss Chandic, the exam appears to be within normal limits. I would just recommend you follow up yearly just as a preventative visit. Do you have any questions for me today?
Not at this time.
Okay, perfect. It was great to see you again.
It was great seeing you.
Have
Thank
a good
you
day.
so much.
Sure.